a different way. Welcome to the Van Jones Show, the author of the House Medicare for All bill and the co-chair of the Progressive Caucus, Congresswoman Pramila Jayapal, in the House on the Van Jones Show. So look, I can't tell you, I've known you for a long time. You've been a champion and a hero. And I just want to say, at a philosophical level, I don't even think we should have insurance for health, period. Insurance should be for stuff you're not sure about. You're not sure if your house is going to catch on fire? Get fire insurance. You aren't sure if your crop is going to fail? Get crop insurance. Everybody's sure you're going to see a doctor. So I would rather not have insurance. I'd rather just have health care. But right now, people do have health care insurance. And so that's really, I think, the rub of it. You can take something away from somebody. Tell us what's good about Medicare for All, and let's walk through some of the concerns.
Yeah. I want to tell you why I'm a believer, why I wrote the bill.
Yes.
And that is that today in America, people are dying because they don't have health care. And you've been across the country, you've heard this. This is not an issue we have to explain to anybody. They literally are seeing their loved ones dying. They are making choices every day about whether they're going to pay their mortgage or whether they're going to get their cancer treatment. They're driving to Canada because insulin costs 10 times as much in the United States of America. Yeah. Their primary insurance plan is GoFundMe. That is where we are today. We have 70 million people who are uninsured or underinsured. But even if you have health insurance, the average person is paying anywhere from $10,000 to $20,000 even when they're covered. So we have a system that costs us $55 trillion over the next 10 years. That's the CMS estimate. And we are in a situation where that is because of the for-profit interests that are built into the system that put profits above patients. Right. So I want a plan that is going to tackle the scale of the healthcare crisis in America, that is going to do two things. One, bring down costs over the long term, because you cannot address this issue without bringing down costs. And number two, universally guarantee insurance to every single American, and no differences in quality if you're rich or poor.
Well, I mean, nobody can argue with those as goals. I mean, if basically those are the two things that we're concerned about. Stuff costs too much and people are left out. But there are real concerns that people have. If we just put up on the screen. One is the idea you're eliminating choice. Yeah. You're going to force me off my private plan. Even if my private plan sucks, you're going to force me in some kind of government plan that is too expensive, and the middle class is going to pay more in taxes. Let's just walk through each of those.
Perfect.
I like being able to choose stuff even if it's bad. I just ate a Twinkie. So help me understand.
We're going to talk about that.
Exactly. So help me understand how you respond to that concern that you're forcing people to do something they may not want to do.
Yeah. Well, I would just say we don't have choice today. Even if you have even if you have private insurance, what choice do you really have? You don't have a choice of what plan you pick. Your employer chooses that. You don't have a choice of what benefits are there. Your private insurance company chooses that. In fact, more and more, because of the rising healthcare costs, insurance companies are limiting who you get to see, what hospital is in network or out of network. And if you lose your job, you really have no choice at all. You got no health insurance. That's if you have insurance now. If you don't have insurance, what choice do you have now? So if that's choice, then I would rather have the choice of having a guaranteed insurance plan no matter where you work. You want to start a small business, you want to run a small business, you want to leave your job and go do something else, you get sick and you need to stay home, you have to take care of a loved one, you have that choice.